my father was a rear-done patient in those little
Igloos.
Yeah.
All right.
From 40-some years ago, 50 years ago.
Wow. Well, I think we're going to go ahead and get started, guys. Thanks for. Are we good? Well, I think we're going to go ahead and get started, guys. Okay. Now I think we're officially going to get started. Thanks for being here tonight, both those of you in person and those of you watching online. I am Dr. Lucas Timms. I'm a naturopathic physician, and I'm board certified in naturopathic oncology. This is the third installment of a series of lectures we've been doing here, talking about naturopathic oncology and different therapies that we use. The first lecture, we did sort of an overview of what naturopathic oncology is as a specialty, what the training is that's involved, and how we sort of fit into the current cancer model. And then last month, we did a lecture that did more of a deep dive into one of our best therapies, which is IV vitamin C, and we looked at sort of the historical use as well as modern day use of that, and some of the research that's being done, and the interest that's building around that. Tonight, I wanted to do a similar sort of format with a different therapy that I'm very passionate about, which is mistletoe. So I'm sure that most of you, when you hear mistletoe, your brain quickly associates that with the sort of ceremonial prop that we use it as here in the States. But like IV vitamin C, mistletoe therapy actually has a long history, dating back nearly 100 years, and is also experiencing sort of a modern day resurgence and interest as far as its role in oncology. My experience, or my journey to discovering mistletoe, I can date that back to pretty much one patient interaction that I had, and this was about 6 years ago. I was seeing patients, and we had a new patient come in, stage 4 pancreatic cancer, and reading through his history and saw that he had been diagnosed 4 years earlier. And at the time of diagnosis, he was already stage 4. And so I said, that's interesting. He had been through a lot of therapies, conventional therapies. And if any of you know the statistics of stage 4 pancreatic cancer, it's a very lethal disease. At best, patients, even with modern day treatments, are, the life expectancy is about a year from their diagnosis. So to see a patient 4 years later that was doing well, and when he walked into the room, he didn't look like a cancer patient. He was hardy and had good lean muscle, and was, completely independent. Didn't look malnourished. So I said, this is interesting. So as we went through his intake and history, I learned that very soon after his diagnosis, he began mistletoe therapy. And he also went through lots of chemotherapy and all the standard traditional treatments. But he wasn't really doing any other he wasn't doing any other integrative therapies. He wasn't doing any complementary therapies. It was mainly just chemo and mistletoe injections. But he had been faithfully doing the mistletoe injections weekly for 4 years. And so this made me think, because I had heard about mistletoe prior to that, in school and residency, and I knew that there were other doctors in my field that were using mistletoe. But for whatever reason, it never piqued my interest enough to say I need to really look into this. And I remember hearing about it with, Suzanne Summers when she first came out with her book. It was probably a couple years prior to that. I know she had mentioned that she had used mistletoe therapy, and so heard about it from multiple different sources. But it wasn't until I met this guy that it really sort of sparked my interest enough to say, okay, I need to figure out what's going on. This mistletoe therapy seems pretty cool, because it's not every day that you meet stage 4 pancreatic cancer patient that's been alive and is doing well 4 years later. So really dove into the research and found that there was actually quite an abundance of research out there. I thought there would be like maybe some obscure clinical trials, and it would be very low sample sizes and a few anecdotal case reports, but quickly learned that there's literally thousands of scientific citations on mistletoe therapy. So the next step, I said, how do okay, this is obviously, I'm interested, the research is there, how do I learn how to do this? And unfortunately, at that point, there wasn't really anywhere in the United States that you could go to learn how to help patients and guide patients in using mistletoe therapy. Really, the only place you could go was to the source, Germany, which is where mistletoe therapy all started. So within 6 months of seeing that patient I mentioned, I had set up a trip to Germany and set it up where it coincided with every 2 years they have a huge kind of summit, a symposium of mistletoe practitioners that come from all around the world and share new research and new clinical experience with mistletoe therapy. And so I went to that, attended that, met a ton of doctors, a ton of other practitioners that, really, again, just continued to build my interest and passion for the mistletoe therapy. And then I spent a lot of time after that symposium going around to different clinics in southern Germany where they do mistletoe therapy. And a lot of these are inpatient clinics where patients will come and stay for weeks, months. They live there on site. They eat all their meals there. And actually, I met quite a few American patients that were there. But just a wealth of knowledge was gained through, studying under the German physicians that had been doing mistletoe for a long time. And, mistletoe wasn't the only therapy they did there. They also did other integrative therapies. Whole body hyperthermia is another treatment they do over there quite often. And they combine them all, and they, obviously focus on diet and lifestyle, and they actually do a lot of movement therapies, so like art and dance therapy and music therapy. So it's really quite fascinating, their approach over there in some of these German clinics. And I wish we would incorporate a lot more of that into Western medicine. But hopefully we'll get there sometime soon. So anyways, got that experience, left there and came back and have been pretty much utilizing mistletoe therapy, in my patients ever since. So I just want to, with that as sort of a primer, we'll jump into the slides and everything, but I just wanted to share with you sort of my journey to how I started using mistletoe therapy, because even today there's a gross lack of practitioners here in the United States that are even aware of mistletoe therapy, let alone have expertise and training in how to use it in cancer patients. I'll also add that the patient, the stage 4 pancreatic cancer patient, did pass away a couple years ago, but was very healthy all the way up until, had very few disease-related symptoms or side effects, and lived 8 years pretty much with stage 4 pancreatic cancer, which is pretty much a medical miracle at this point if you look at the literature. So I really have a lot to thank to that patient for kind of bringing me to where I'm at right now. So I only have a few slides, and we'll have plenty of time for questions at the end, but through these slides, we will take a look at sort of the history of mistletoe therapy, going back hundreds of years all the way up to modern day. We'll look at some of the scientific basis and clinical evidence for its use. We'll also discuss sort of its role and relevance in integrative oncology. And we'll look at some of the sort of cherry-picked studies that I've selected just for us to kind of take a look at that are really kind of hallmark studies. And then, like I said, we'll have questions. So I wanted to give a little bit of a visual for you guys to really sort of appreciate the uniqueness and the mysteriousness, if you will, of the mistletoe plant. You can see just visually that it's a very different plant than what we see for a number of different reasons in the plant kingdom. It's a parasitic plant. It lives on other host trees. And so how it gets there is, birds eat it, and then their droppings, of course, land on the branches of other trees. And from there, a few years later, you sprout one of these mistletoe plants. And they grow in an interesting fashion. It's almost like this, these orb-like spherical growths. They don't have a traditional root system like most trees and plants do. They have a true center that everything kind of grows out from, which is almost not seen anywhere else in the plant kingdom. And they don't orient themselves in any way towards the sun, which is also very odd and unique in the plant kingdom. Another characteristic that's very unique about mistletoe is that it produces its fruit, or the berries, in the winter, which is contrary to all other fruiting trees and plants. Usually it's in the warmer months. So we see this kind of direct opposition to nature with the mistletoe plants. And I think that these, obviously these visual characteristics are probably what led to some of the early discovery as far as, why did people start looking at mistletoe as a medicinal plant, right? Well, it's very different. It obviously is an odd and unique plant. I think that's why some of the early pioneers probably looked into it more as having some special medicinal purposes. The white berries you can see down there, there's red berry mistletoe as well, and that's kind of the one that we're more familiar with over here. The white berry, or the European mistletoe, is the more medicinal form, and it's actually more toxic than the red berry one. These are native to most European, Central European countries, but you find them mostly in Germany, which is another reason why that's kind of where it started. Different parts of the plant are used to cultivate and produce the medicinal extract. You have different compounds that have been isolated that come from different parts of the plant. So the stems and the radial portions produce a lot of what are called viscotoxins. These are the compounds that have been shown to have a lot of the direct anti-cancer effects, whereas the berries, the fruit, the white berries, produce more of what are called lectins. And these are the compounds that have been shown to have more of the immune boosting effects of mistletoe. The companies that make the modern day mistletoe extracts, they combine both a summer harvest and a winter harvest, because in the winter you've got the berries, as we talked about, but in the summer you have a much richer concentration of the viscotoxins within the stems and the radial portions. So they blend the two harvests together, and there's a whole process involved with how they, boil it all down to this extract that the patients end up with, which are these little vials you see here on the left. And these are, these ampules or vials are what are actually given to patients. And then these solutions are drawn up into needles. And the most common form of administration is through subcutaneous injection. And so patients are given usually these boxes, which you can see in the middle picture there, that contain a series of these ampules. And there's two phases of mistletoe treatment. We start with what's called an induction phase, which is where we are slowly increasing the dose. So patients get a box, and each ampule will slowly increase the dose as they go. And what we're looking for is, when does that patient produce this small skin reaction that you see in the picture there on the bottom. This tells us that particular patient is having a desired immune response to that dose of mistletoe. And everybody's different, so it's a very individualized approach. It's not like, with a lot of pharmaceutical medicines or Western medicines, it's every patient gets the same dose, right? You kind of figure out what the median dose is for most people, and everybody just starts with that. This is a highly individualized and specific dose for that patient and their constitution. So some people might produce a reaction at 10 milligrams. Some patients might get up to 50 milligrams before they produce that reaction. But this is what guides us in order to proceed into what's called the maintenance phase. And this is where patients continue on whatever dose created that skin reaction, and they continue to inject themselves 3 days a week. And this can last months, years. Like I said, with the patient I told you about, he had been injecting himself for 4 years. And there's some breaks, that are worked into that, and different rhythmic type dosings that are recommended in different situations and different tumor types. So it's not always a continuous, 3 days a week type injection schedule. But for the most part, that's kind of how it works. Like I said, the subcutaneous injection administration is the most common and the most historically used form, but some of the newer breakthroughs have been with intravenous use, intratumoral injections of mistletoe, and even installation of mistletoe solution into the abdominal cavity, like for things such as malignant ascites. And there's been a lot of real exciting preliminary data come in with some of these other modes of administration. And so I think that we're going to continue to learn more and more. And at some point, we might get away from doing the subcutaneous injections, although for now, it still seems very effective to do it that way. And it's quite easy because the patients can inject themselves as opposed to IV therapies where they have to constantly be coming into a clinic or have some sort of home nurse. This is a therapy that patients can literally administer themselves in a matter of minutes. And it's very well tolerated. Other than the skin reaction, there's very little side effects, very little. This is a very small needle. It's similar to a diabetic insulin syringe. It's only going about ½ an inch under the skin. And like I said, it's very well tolerated. Some patients do get low-grade fevers and some flu-like illnesses, but those are usually very intermittent and mild. So now that I've kind of, filled you guys in on how the mistletoe is used, we'll back up and kind of go through the historical timeline. So I mentioned it's been around for a long time. It literally has been around for a long time, going all the way back to medicinal uses being noted with the ancient Greeks and Hippocrates. But we don't see it kind of used as an anti-cancer therapy until around 1920, where we meet this fellow named Dr. Steiner. He was an Austrian, and he teamed up with a Dutch physician, Ida Wegman, and together they were basically the first people to start treating cancer patients with mistletoe therapy that at least has been noted in the historical records. And out of this, they published a lot of research. Dr. Wegman went on to found a cancer research institute that was solely kind of focused on studying mistletoe's effects in cancer patients. And this sort of, continued to produce more and more investigation, and led to the formation of what's called anthroposophical medicine, which is, very akin to naturopathic medicine. It's sort of Europe's version of naturopathic medicine, a very similar sort of philosophy and approach as far as combining pharmacologic therapies with more holistic treatments. But mistletoe is one of the main cornerstones of anthroposophic medicine. And a lot of these doctors that I trained with in Germany, they have the title of MD, but they call themselves anthroposophic physicians. So presently, in countries like Germany, Austria, Switzerland, mistletoe is an approved therapy, and it's highly frequently used by cancer patients and recommended by oncologists over there. It's covered by their insurance programs. And even in a lot of the more recent countries that have started to adopt it and approve it, like Japan and some other Asian countries, it's quickly becoming the most frequently used sort of integrative therapy in those countries. looking towards the future, I think that we've well established it as something that can improve quality of life in cancer patients. We've well established it as something that is safe, very little side effects, well tolerated. So that next step is really, can we prove that, at least from the research standpoint, that it's having these anti-tumor and anti-cancer effects that the clinicians have obviously been observing for many, many years. When you talk to these German anthroposophic doctors, they could care less about the research because they've seen it, before their own eyes in these patients. But oftentimes with these therapies that have been around a long time, even IV vitamin C, like we talked about, oftentimes we have sort of a reverse engineering process where the clinical evidence comes first, and then we back up and start doing the bench side work to kind of prove what we already know, as opposed to pharmaceuticals where they start in the lab and then work up towards clinical use. So it's a little bit of a backwards model, but I don't think that that's anything that should be looked at as a bad thing, because again, clinical evidence should be the highest form of evidence. And of course, the target for future, investigation should be to establish mistletoe therapy as more of a standard therapy, not just in Central Europe and Asia, but across the globe. So I said it was well researched. It's probably the best researched herbal medicine that we have. More than 2,000 scientific publications. These numbers are probably a little bit outdated. It could be well over that by now. More than 130 clinical studies, more than 40 prospective randomized clinical trials. The biggest scrutiny of the research and the clinical studies that we do have, because most of these studies have looked at mistletoe use via the subcutaneous injections, is that it's very difficult to have a blinded study. And the gold standard in medicine is this randomized control, double-blind placebo trials. And so when you're giving a therapy that's an injection that produces a very noticeable skin reaction, it's hard to recreate that in a placebo. So it's almost impossible to blind these studies where the patients and the doctors don't know what they're getting. And so that's kind of been something that the conventional, the Western medicine doctors that have looked into the studies, they say, oh well, they're not blinded, and so it's weaker evidence. But that's why a lot of the newer studies that are starting to open, and we'll talk about those as we go, are starting to use the IV form more, because it's easier to blind those trials. Okay, so mechanisms of action, what's actually going on in the blood, in the cells. First and foremost, mistletoe is an immunotherapy. Okay, it stimulates many different cells within the immune system: lymphocytes, natural killer cells, dendritic cells, macrophages. You can think of all these as sort of like different sectors of the armed forces, right? You got your Navy, your Army, your Air Force. They're all kind of working in unison to help fight off pathogens and offending agents and tumors and things of that nature. So, and we know that cancer essentially is a disease of the immune system. And even more, recent breakthroughs in conventional oncology have been with immunotherapies. We also have an increase in these tissue-specific eosinophils, which have more of a kind of an inside-out immune effect within the tumors. One of the ways in which mistletoe helps with quality of life and helps patients to tolerate chemotherapy and radiation better is that it has a protective effect on the DNA of our healthy cells. And this has been well documented in a number of different studies, and again, is a major mechanism of action. Tumor inhibition, again, we're still learning more about this. But we do know that when you inject mistletoe directly into cancerous lesions, that it stimulates apoptosis or programmed cell death, which is a mechanism by which a lot of conventional chemo drugs work. And then it also has anti-angiogenic effects, which is where it has the ability to block the signal that creates new blood vessel growth. So a way in which cancer cells can gain access to new blood supplies and nutrients and grow. And this is just, I think, kind of scratching the surface, because again, with a lot of these herbal therapies, natural therapies, the real magic to them is that they don't just do one thing. You know, there's kind of this recruitment of effects that happens, and the synergistic of effects that happens between all these different active compounds in the plant itself. And so I think we're going to continue to sort of unearth other mechanisms of action that help. So that's sort of like, you know, the microscopic level, what's going on. As far as clinical effects that are observed in patients on mistletoe therapy, of course, we see inhibition of tumor growth and protection of the healthy tissue. We see increase in endogenous resistance and regulation. What does that mean? It's a restorative effect, and you see this a lot in the literature, especially when the Germans write about mistletoe. They call it the ultimate restorative therapy for patients. So this kind of, you know, with cancer growth, we've sort of lost the ability to regulate those cells in their turnover and their proliferation, and so mistletoe is thought to kind of bring back balance to that system. Stimulation of thermoregulation, kind of a fancy way of saying it heats up the body, and this is part of that immune response that we see, why you see low-grade fevers in these patients, and that's all thought to be beneficial. You know, a fever is one of the body's ways in which it can fight off infections and other types of diseases. So pretty consistently in patients that have cancer, you'll notice that their body temperatures run quite low. So with the mistletoe, we have patients, you know, they'll track their temperatures as they're doing the injections, and it's pretty consistent that their core body temperature will increase throughout the process. We get improvement of their general condition and performance, and this plays more into, I think, when you're using it more in the palliative setting. Irrespective of the local tumor, I've seen patients where their tumors might be progressing, but they still have a better overall sense of well-being. Their quality of life is still good. The rest of their body is still functioning well. And I think that this is a real benefit when you have patients that are very late stage and have a lot of side effects from the treatment they've already been through. It really can help to improve, just like I said, the overall general condition and performance of the patients. And then occasionally we do see decrease of tumor-associated pain, which for some people can be a huge benefit. Okay, so like I said, I did sort of cherry pick a few studies for us to look at. This one, out of 2004, it was looking at mistletoe therapy in conjunction with chemotherapy and conventional treatment for a number of different tumor types. It was a prospective randomized trial, and they showed that pretty much across the board that the patients that got mistletoe compared to patients that didn't had statistically significant improvement in their quality of life, many different measures of quality of life. So fatigue, insomnia, nausea, loss of appetite, and they tolerated their chemo better. So they had less breaks due to bone marrow suppression and severe adverse effects of nausea and vomiting. Here's a study from 2014 that looked at it in the adjuvant setting in breast cancer patients. So these are patients where they've had their sort of definitive surgery and they're getting chemotherapy to mop up any microscopic disease. These patients were they had two groups randomized, and some patients got the mistletoe alongside the chemo and some didn't. And again, showed greatly improved quality of life in the group that had the addition of the mistletoe therapy. Here's actually one of the few US-based studies. This was out of the National Cancer Institutes. It was a phase 1 study looking at, their question was, does mistletoe actually interfere with the chemo at all, or does it have any counterproductive effects? And so they chose a model using gemcitabine, which is chemotherapy that's been around a long time and is used across a number of different tumor types. And they found that there were no drug interactions with the Gemzar. It didn't take away from the effect of it. And actually that patients were able to receive much higher doses of the Gemzar because of these effects of, protecting the DNA of the healthy cells, decreasing the bone marrow suppression that happens. And so this suggested sort of, that you could push some of these chemotherapies potentially with higher doses without causing the same side effects. So this study is really sort of was an eye-opener for me. It was one of the first studies that I came across when I was doing my initial research after seeing that stage 4 pancreatic cancer patient. This was done in published in 2013. It's out of Serbia, and it was I believe there was about 250 patients in this trial, and they had either stage 3 or stage 4 pancreatic cancer, and these were patients that had failed first-line chemotherapy. And so they had two groups. One group would either get the standard second-line chemotherapy, or the other group was randomized to get just mistletoe. So this study did not combine the mistletoe with chemotherapy. And what they found was that the group that got just the mistletoe actually had a very relevant prolongation of their overall survival, actually a few months longer than the standard second-line chemotherapy, which was 5-FU. And of course, they also saw, less disease-related symptoms in these patients, better quality of life. And so, this study alone should have sparked much more interest across the globe in Western medicine, but kind of, gets lost in the shuffle. I remember seeing it mentioned in some of the, ASCO literature, but it was kind of tucked away in like this, really small font in the back of one of their, posts. And I doubt most oncologists even read it. But this is a real hallmark study, and I think that this shows the potential going forward of mistletoe actually being a viable therapy, possibly on its own, not just in conjunction with chemo and radiation. So one of the most exciting things that's happened in the past few years is this opening of a trial at Johns Hopkins. And I actually, when I was in Germany 5 years ago, I met one of the principal investigators that was heading up this study. And at that point, they were still kind of trying to generate the funding for the study and still kind of putting the finishing touches on the design. This study, they're going to be doing mistletoe IV. They're going to be doing it in conjunction with standard chemotherapy agents, but it's a 2-phase study. So they're going to first be looking at safety and tolerability. Then the second phase, they'll be looking for preliminary efficacy. And I think that hopefully with some positive results from this study, it will, especially coming out of a well-regarded academic institution like Johns Hopkins, I think that this will be sort of the big boost that we need in order to get more people on board in Western medicine and conventional oncology. And so we're anxiously awaiting the results, which are supposed to be, coming over the next year or two. So that's the end of the slideshow. We've got obviously quite a bit of time for questions. So I think we can just open it up at this point.
what makes, the interest on behalf of the standard Western medicine and
Why did
pay
they?
attention to mistletoe
Well,
therapy versus other therapies that have been in the past used also for cancer treatment? For example, vitamin D, or for example, the grape, um, the grapeseed treatment.
Mhm.
Those clinics were all closed down. And
yeah, we've lost a lot of therapies.
but why all that has been closed, ignored, all those doctors and clinics have been obligated to leave the country, and now they are listening to mistletoe. Where's the difference?
I don't have a good answer for you. All I can say is that I think that we are seeing a real sea change and sort of a changing of the guard when it comes to medicine here in the U.S. And a lot of the younger oncologists and researchers that I talk to are much more open-minded and I think able to sort of accept that there might be things outside of the conventional model that we're missing out on, that do have efficacy and do have utility. I think we're always going to run into with some of those things, you know, the lack of clinical evidence, right? Lack of research studies. But with mistletoe, that's not the case. You know, if, like I said, the research is there already, at least for its utility as an adjunctive therapy to help support cancer patients. I mean, we already have many countries around the world that have approved it. But you know, that's it's going to take a while, even still, even with something like mistletoe. It's not going to be overnight. And these things, you know, medicine moves very slowly. I wish I had a better answer for you as far as.
You have patients following the treatment here in the United States.
Mistletoe therapy?
Yeah.
Yes, I have almost all of my cancer patients I've put on
Okay.
mistletoe therapy.
And it is legal and it's allowed and it's being done and.
It's not an FDA approved therapy, but there are several doctors like myself that have done training and that are, again, very comfortable with using it as far as knowing the safety, knowing the benefit for quality of life. I'm very careful not to guarantee patients that, you know, mistletoe is going to cure their cancer or be this magic bullet that they've been missing. Again, we do this in conjunction with our whole approach. But there are doctors here, and there's some websites you can go to locate doctors that do mistletoe therapy in the States. But it's still only a few handfuls. So we need more people that can get trained in this therapy, so that more patients can benefit from it. Yes.
Pancreatic cancer phenomena in your research and your findings? What other research for other types of cancers?
Yeah, I mean I shared my patient that I had was a pancreatic cancer patient. And then there was that one great trial, but the other studies were in lots of other tumor types. Breast cancer is another one that there's a lot of studies in. Talking to the German doctors, they use it in all tumor types. There's different forms of the mistletoe. And these depend on the different host trees that they cultivate the mistletoe from. So whether it comes from an apple tree or a pine tree or an oak tree, you get slightly different characteristics of the medicine. And so over the years, they've figured out that certain forms from certain trees respond better in certain tumor types. And so as part of getting trained in how to utilize mistletoe, you have to know which type to give to which tumor type and in which setting as well. So there is a little bit more of, some expertise that needs to be developed in order to give patients the best type. But it is effective across all tumor types. And I've used it in pretty much all standard tumor types and had success with it. Yes.
So you, because I understand it's really just to
Oh no, if that's the message you got today, I hope that I can help clarify that because the doctors that have been using it for a long time, they know that it helps to treat the cancer itself, and they've seen this clinically for decades and decades. The research that we have really only 100% proves that it does improve quality of life, but we also have studies like that pancreatic cancer study where patients had better overall survival on that versus standard chemotherapy. So the evidence is still kind of catching up to the clinical practice, but I see it as both, a restorative medicine, an immune boosting medicine, but also an anti-cancer medicine in and of itself.
So that was going to be my next question. Is it used as a preventive?
It can be. It can be. It's. I'd say that's the most untapped setting that we have as far as the research. But a lot of doctors, of course, if patients have a cancer diagnosis and then they get into remission, at that point there's lots of literature and ways to give it them. But as far as using it, say in a patient that's never been diagnosed with cancer but might have a strong family history or other genetic risk factors, I think that's still a setting where we need more information to help guide us in the best way to use it. I don't know if it makes sense to start patients that have a strong family history on thrice weekly mistletoe injections, starting at the age of 25. But we have to kind of figure out what's the best way to use this. And maybe it is sort of a pulsed kind of intermittent dosing, or maybe there's other forms of administration that we haven't yet tapped into. The IV form definitely is something that we're still learning about as far as how best to fit that in. A lot of the clinics over in Germany are utilizing combinations of these different administrations. So patients will get the subcutaneous injections, but then, around surgeries, they might do a few IVs. And then if there is actually a tumor that they can get to, whether it's through a scope or just superficially, they'll also inject the tumor itself with the mistletoe. So there's a lot of investigation, a lot that we're still learning about it. But I think that the prevention setting is something that needs more attention and more investigation.
So, you should, if you don't mind, you keep it on.
He died from complications. I mean, most cancer patients don't actually die from their cancer. Most of them die from infections or malnutrition or kidney failure, or it's not always necessarily due to the tumor itself, although they technically say they died of complications of their cancer. He did have a genetic kidney disease. That patient did, and I think at the end of the day, that's what they ended up saying. He died of his pancreatic cancer, but I think the kidney disease was basically what was his sort of downfall at the end. But like I said, I saw him probably 2 weeks before he passed, and he was still just as hardy as ever and eating like a horse and looked very healthy and robust.
How did you stumble across this? Because this is the first time I've kind of heard of it. This therapy, obviously there's numerous findings, therapies and stuff like that. What made you know?
Yeah, so it really was that encounter with that patient. Again, like I said, I had heard of mistletoe kind of just from different sources before that. I kind of knew of it as this potential anti-cancer therapy that was out there, but until I met that patient, I had never really dove into the research. And then once I dove into the research, I quickly was like, oh my gosh, this I felt like I found like the Holy Grail. I was like, why isn't everybody talking about this? And so that's when I decided to go to Germany and do the training over there. And I've been trying to tell as many people about it and share it with as many of my patients as I can since I've been back. So.
Do they actually have to go through, in this situation, you or a doctor like yourself to be able to investigate the whole makeup of what they're going to need, how it's administered correctly?
That's the best route to go through. I'm not going to tell you that there's maybe not other ways of obtaining mistletoe products, but it's always advised to go through a practitioner that knows how to, walk you through and guide you through the administration. Even though technically you're, doing the injections yourself at home, it's best to get that education on how to safely do your injection, how to monitor the dosing, the skin reaction. There's quite a few pieces to the puzzle that you need someone that has expertise in order to kind of walk you through all that.
So with mistletoe being a supplement, an additional portion of treatment,
Correct.
does that get you into interaction with other oncologists or?
Try, if they'll listen.
Okay, but I mean, okay, if you've got a cancer patient that comes to you that's diagnosed with cancer,
Mhm.
and you establish a treatment requiem,
Mhm.
you can actually establish the chemotherapy and the mistletoe therapy.
I don't prescribe chemotherapy
Okay, that's what I'm
myself.
saying.
We do more of the integrative therapies like IV vitamin C and some of these more adjunctive therapies. So we, leave all the chemo and that stuff up to the conventional oncologists.
Okay.
Ideally, we would be able to work hand in hand with them. And that's what, for 8 years prior to coming here, I worked in a facility, Cancer Treatment Centers of America, where I did work directly alongside medical oncologists, radiation oncologists, and, we worked in collaboration. So here, we're sort of not set up to be directly, under the same roof as the oncologist, but we're always happy to try to, collaborate with them. The biggest problem we run into is that they don't usually want to collaborate with us. So, even though,
That was kind of my question.
or with the patients sometimes, so
That
it's
was kind of my
a
question.
difficult thing to, but
Collaboration.
that's why studies like the one out of Hopkins is really going to hopefully help us to, kind of bridge that gap between, because, they're not going to ignore positive study coming out of Hopkins. Well, some of them might, but again, that's why I think, there is this changing of the guard, and I think a lot of the newer, recently trained, younger oncologists and researchers that are out there are much more open to these types of things. And that's been my experience working with a lot of oncologists at CTCA is that, that old guard kind of love to dig in their heels and be very kind of, reticent about any sort of naturopathic treatments or herbal medicines or things like that. They just, they don't want patients doing any of it. No matter what the research shows, it's just that all that stuff is bogus, and I don't want my patients on it. But, as we start to break